hippies. Anyway, it's good to always remember where we're standing and not feel guilty, but like we've got to do better in the future, haven't we? Anyway, I really appreciate you coming, and my name's Michael from the Hemp Embassy, and we've done these Medicans for quite a few years now. How many of you have never been to one? Good on you for coming. So really, we get so many inquiries in the Hemp Embassy about using medical cannabis now. It's had quite a bit of publicity. You know, I've been smoking pot for 50 years odd. I should tell you a couple of things. It completely stopped me getting migraines, and if you've ever had a migraine, they're so debilitating. It was like, I've seen it stop young children who have 50 epileptic seizures a day or 150. I've seen it completely stop them. So when you see experiences like that, you have to question what's been going on. And in summary, we've just been totally lied to about cannabis. 100 years ago, it was in 80% of the medicines. Before pharmaceuticals came along, cannabis was in about 80% of the medicines. And the opium poppy was probably in just as many, because these are the best pain-relieving plants on the planet, basically. Cannabis is unique in that you can't really die. No one's ever died in 10,000 years of recorded history. You can knock yourself out to sleep, and definitely for some people, it stirs up mental health. It's just in rare people, and it's particularly since hippies like my generation got hold of the old cannabis, traditional bush cannabis, and bred stronger THC, the psychoactive cannabinoid. You know, Dr. Teh will be the first speaker. He'll explain it to you more. But we've all got an endocannabinoid system. They only discovered 50 years ago. And there are a few other plants that do it, but it's like we've grown up in harmony with cannabis almost. And it was the most used plant on the planet for hundreds of years. Not just because of its medicine, because it's got a unique, strong, flexible fibre, makes fantastic clothing, makes the best rope. The word canvas came from cannabis. It also has a fantastic seed, highly nutritious, high protein, all the omegas. You know, all those things are in the Hemp Embassy, and why we started the Hemp Embassy was to try to educate people about the plant, about the history of the plant, and about prohibition. Because really, it's all about money, the war on drugs. If you can corner the market on pain relief, you've possibly got the best business on the planet, is how I see it. Because, you know yourself. If you've got pain, you've got a friend with pain, you find the right medicine that takes that pain away, they'll sell the shirt off their back to you. And the pharmaceutical industry knows that well. When you go doctor's training now, you learn all about physiology, but basically you only learn this is the pill to take to deal with that disease. And the rest is passed over to big pharma's laboratories. Whereas in nature, we have a massive history, all the plants have a use, and cannabis is an extraordinary plant. Basically, I think it's its anti-inflammatory properties. And for my layman's understanding, most pain is swelling, is inflammation. So I think that's the secret with cannabis. And I think it's even the secret mentally for us people who love it, because you kind of let go a bit. You surrender a bit. It's a female plant. We don't smoke the males, we pull them out. So it's a victory for the women, which has been great to see happening the last few weeks. We are definitely not Parliament House in Nimbin. Anyway, I want to, Dr. Teh, introduce you to Dr. John, who I've known for a couple of years, and he's actually a pretty local fellow in the Tweed Valley, but he started the Plantmed clinic in Brisbane, and it's been a huge success. And for me, he pretty much gives the best presentation to introduce you to the plant and give you a bit of an idea what it's about. And I mean, I discovered that cannabis stopped me getting migraines. You know, I discovered Nimbin has got quite a few epileptics who don't have seizures because they smoke pot all the time. The village is full of alcoholics who don't drink because they smoke pot instead. Possibly it's the best herb drug on the planet for getting off other addictions. So the Hemp Embassy, we've got people working there who were alcoholics, who were ice addicts, who were heroin addicts, and now they smoke pot. So it's interesting. So I don't want to waste your time anymore, but there's quite a few people here from Nimbin who smoke pot for a long time. You're welcome to talk to any of us. You're welcome to go to the Hemp Embassy at any time. Dr. John will talk for an hour or so. Then Dr. Jamie Rickord, who's there, standing there, will talk for an hour or so. Then we'll have a break. Then David Halpern, ex-magistrate local, that's him there on cue. He will talk for an hour or so. And then we'll have a Q&A on stage up here with everyone. So you'll all get a chance to ask all your questions. Please don't be shy about it. And many thanks for coming. The toilets, you go to the far corner out there where there'll be a great lunch on. You go to the far corner, you walk down a long ramp, and they're at the back up there. So just go to that corner and then down a long ramp back towards the street. And this is Disco Sister. She's basically in charge, really, not me.
Hello.
And this is Dr. John. Thanks heaps for coming.
Okay. Sorry, just a quick interruption. Please note there are two cables, one going that way and one going that way. Please don't put your chairs or trip on them or stand on them. Secondly, there is a 10-metre microphone for questions, but the speakers will repeat the questions as well if you can't make it to the mic. Okay? But the mic here. Over to you.
Thank you, thank you. Good morning, everyone, and thanks for coming down to Nimbin today to learn about this amazing medicine. So first of all, let me introduce myself. I'm Dr. Drteh. I run a cannabis medicine practice in Brisbane. I'm currently treating people every day with cannabis medicines. I've been in this space since legalisation began back in 2016. So at the clinic, we've done over 3,000 patients now. Currently got that many on our books. And when Disco Sister comes back, we'll change the slide. But I'll just talk on a little bit. So I'm just going to assume everybody here, there'll be a lot of different levels of knowledge. So I'm just going to start from the beginning and start from the basics about cannabis medicine. And the basics are, of course, THC and CBD. So the main cannabinoid is definitely THC. THC, or tetrahydrocannabinol, is the part of cannabis which people smoke for fun. It's the part that gives recreation. It's the part that makes you feel happy. So it's the part that everyone knows about, that we associate with the hippies from the 60s. The other, which is a very important part of cannabis medicine, is CBD. So it's the second most prominent cannabinoid in the plant, and its name is cannabidiol. Now, CBD, if you take it, you won't notice anything straight away. It doesn't have any high or psychoactive effects, so it's completely different to THC. It's a completely different shape, and it works in a different way. CBD, next slide please, sister. CBD is, next slide, thanks, is a great anti-inflammatory molecule. So when we take it, it works to reduce inflammation throughout our body, and it's a great anxiolytic molecule. And importantly, anxiolytic meaning reducing anxiety. And CBD also helps to balance out THC in our bodies. If we take too much THC by itself, we can actually get a little anxious, or we suffer from side effects of cannabis, which are fairly minimal, and I'll get into those soon. So THC is an amazing molecule, and what it does is it goes into our body and it mimics a natural molecule that our bodies make. So in our body, we have a thing called the endocannabinoid system. What that means is inside cannabis system. So we've always had this system. Every animal on the planet has this system as part of its basic makeup. And what we do all day, every day, is we secrete natural cannabis in our bodies to regulate all of the other functions. And when I say all of the other functions, I mean all of the other functions. So that implies pain regulation. That implies sleep-wake cycles. That implies gastric motility. That implies menstruation, and that implies aging. That implies every system in our body. That implies inflammation response. So that's why if you look at this slide, and I know it's a little small, But don't worry about the pictures too much. I'll be talking about them anyway. There's lots of effects of THC in our body. The one effect that we use most commonly, I suppose, in medical practice would be for pain. And I'm sure, hands up anyone in this room who's got pain in their body. Right. So that's about right. Over 50% of patients will come in for pain. Okay? So THC is the main molecule that gets rid of pain. CBD will help with pain, but only from an anti-inflammatory effect. So it's a great pain reliever or analgesic. THC is an antiemetic, which means it helps reduce nausea and vomiting. So that's why we always think of cancer patients using THC to help with their symptoms, or cannabis to help with their symptoms. It's the THC molecule that really... So if we were to give CBD to a cancer patient, they probably wouldn't get any nausea relief from that medication. THC is also an anti-inflammatory. It's an antipruritic, or helps stop itching. So for skin diseases like psoriasis and eczema, it's a great thing topically or orally. THC, interestingly, is a bronchodilator. So everyone obviously associates smoking with cannabis. In the medical field, we never promote smoking. Not that cannabis smoke is carcinogenic. There's no studies that say that there's an increased chance of cancer from smoking cannabis, but it can be irritant to your lungs. It is smoke, and it is particulate matter, so we don't recommend smoking, we recommend vaporization. Vaporization is a method of inhaling cannabis without burning it. You essentially heat it up, so you boil off all the important elements in there and inhale them into your body. So it's much healthier. So when you use that way, THC can be used as a bronchodilator. So I've actually got patients who are asthmatic, or have COPD, or chronic airways disease, where we actually use tiny amounts, less than psychoactive, so not enough to get someone high, to actually assist with their breathing. So by inhaling this small amount of THC, they get a bronchodilation effect of their lungs, and they can breathe easier. So it's kind of like their asthma puffer. So it's never something that I would recommend that you would only use for your asthma. You would definitely want to have your puffers and other sort of things as well, but it can be used in that way. THC is a great muscle relaxant. It's a great relaxant throughout our whole body. So not only our skeletal muscles, our voluntary muscles, we all feel tension in our necks when we're stressed, and THC will help relieve that muscular tension. But not only those, our muscles, so our blood vessels. If we've got hypertension, THC will actually dilate your blood vessels a little bit too. That can be used in that way, but we don't rely on that if you had blood pressure. But you have to watch out for it. And also, THC is a great antioxidant. It's been shown to be a neuroprotectant, so to protect the brain damage moving forward as we age. One important thing to know about cannabis, just very, very, very safe. CBD, there's really no side effects to it. At high dose, there are some liver interactions which your doctor or your health provider should let you know about and monitor for you. But CBD, essentially, you can eat it by the spoonful and you're not going to have any negative health consequences. You're not going to die. THC, you have to be careful with, but once again, you can never die from a THC overdose. You may feel very uncomfortable if you have too much THC without letting your body get used to it. You may feel anxious or even paranoid, but it's to kill yourself or stop yourself from breathing any amount of THC. So THC is a much more potent molecule, so we handle it with more care, but you can't die from cannabis medications. Next slide, please, sister. I'm going to skip through that one as well. So, and that one, thanks. So THC works throughout our body with many, many different ways. And the dosing we use, it's very variable. It depends on what your symptoms are, how bad they are, how your body responds to that medicine, other factors, what other medications you're taking as well. So the dosing of THC may be as low as 1 milligram and people can get an effect. It may be as high as 100 milligrams or more for that particular patient. So the range is very wide. Generally, most patients that come to our clinic are what are called cannabis naive, or haven't smoked cannabis or tried cannabis ever. And generally we don't say, here's a joint, go and smoke that. They'll be reckless. We usually start with oral oil medications because we can judge the dose very accurately. So if we say you take 0.1 of a milliliter of this oil twice a day, and I know that's 1 milligram, okay? So it can be accurately judged. That's an important thing. Oral oils are a much smoother way to introduce cannabis to the body. When you take cannabis orally, you get a nice smooth shape, kind of like this, over 8 hours. It takes about an hour to start, and then it slowly builds and then slowly tails off. So if we do 2 or possibly 3 doses per day with an oral oil, CBD and THC, then we'll cover the symptoms for the whole day. If you smoke or vaporize and inhale cannabis, which is another method, then you'll get an immediately large peak of THC and CBD in your blood. And that's instantaneous, within 5 minutes. And then that'll then tail off over 2 to 4 hours. So the psychoactive effect, or the way it makes your head feel, the high feeling, can be a lot stronger when you're using inhaled cannabis. So if you are a person that hasn't tried cannabis before, it's probably not a good idea to jump straight into the most strong and potent cannabis flower you can find, but rather ease your way in with a THC oil which is balanced with CBD. Next slide, thanks sister. Next, thanks. So that brings us to CBD. That's the CBD molecule. It is very similar to the THC molecule, but it differs in enough ways that it won't actually bind directly into our cannabis receptors. Next slide, thanks. So CBD, as I said, has no high effect. And it's a very, very important molecule to include in cannabis when you're using it as a medication. If you're perhaps using THC recreationally, you may not want to use CBD, not from a health perspective, but as a personal choice, because one of the main things that CBD does in the medical sense is reduce that psychoactive or high feeling. Now, a lot of people will find that feeling a little uncomfortable initially, especially if there's no CBD involved. So I make sure in my practice that all patients have adequate CBD in their treatment regime, and that will reduce anxiety, just generally, but also reduce anxiety that may be associated with the THC dosing. So CBD is an anticonvulsant, and it's the big medication which we all have seen on television in regards to epilepsy. And childhood epilepsy is obviously a big thing we see on television because it tugs at our heartstrings. CBD is an excellent anticonvulsant. It's not as potent a molecule as THC. So with CBD, we often need higher dosings. So for instance, THC we may dose somewhere between 1 and 20 milligrams twice a day, roughly. Whereas with CBD, I would probably start at about 20 to 30 milligrams twice a day and then increase from there. And in the case of epilepsy or seizure disorders of all kinds, the amount of CBD is often a lot higher. So up to 15 milligrams a kilogram is what the studies say, but that's actually a fair bit if you do the maths. But often over 200 milligrams a day of CBD will be a common thing. And for severe epilepsy, I've got patients on up to 400 plus milligrams a day. Now that is very expensive, but saying that, I've had excellent results in epilepsy patients who are, one particular one that springs to mind, had been having seizures for her whole life, since she was a teenage girl, and she came to me probably aged about 50 years old. And from having 35 plus seizures a day, we've now got her on a fine balance where she will rarely have a seizure, and she's had periods of 6 to 8 months seizure free, which to her is an amazing thing. But that was through a lot of diligence and a lot of high dose CBD, as well as a little bit of THC put in there as well. So I think when you're dealing with those sort of ailments, it is very important to go and get a medical professional to help you. When you're using CBD doses that high, even though there's no side effects to CBD and it's completely safe, there are some things we need to look out with, especially the way other medications may be broken down by your liver, because high doses of CBD like that can actually slow down some of the enzyme in your liver, and particularly in the case of epilepsy, a lot of the seizure medications may not be broken down as quick as we might expect, and their levels may rise. So I would always recommend, if that is something, seizures is a problem for you, to go and get some expert advice and look into that. So that's the first two there. CBD is an analgesic, but really only from its anti-inflammatory effects. So if you've got proper strong pain, like back pain from nerve root compression, CBD is probably not going to do the trick for you. CBD alone will probably do the trick in terms of anxiety or mood disorders. CBD has an antiemetic and anti-nausea effect, but not really as strong as the THC. And once again, it's neuroprotective. So there's a lot of work being done looking at CBD, and we can see signs of damage to the brain and certain chemicals in the brain, which will be elevated when we age and we get deterioration of the brain. CBD is shown to be a neuroprotective agent. So taking it, even if you're not sick, can be a good idea, like a supplementation, to protect that brain against aging. And we all age. So it helps reduce the oxidative signs of damage in our brain. Next slide, please. I'll skip through that one as well. So I'm not going to go through all of these slides because some of them are aimed at a different audience. So I'll skip through that one as well, and skip through that one as well, and that one as well. So dosing of CBD. As I mentioned there, dosing for CBD usually requires a lot more milligrams of medication. Skip through that one, thank you. And we'll skip on there. So, decarboxylation. So when we smoke cannabis, it heats up, and that activates it. That's called decarboxylation. So we're actually losing an acid molecule off the side of the THC. So if you have a fresh plant of strong cannabis, and you juice that plant and it's full of THC molecules, it'll be in a form called, a raw form of THC called THCA, and that A stands for the acid bit. So this little diagram is just saying when you heat up cannabis, you lose that A, or the acid bit, and that changes the shape slightly. So if you ate that whole raw plant of cannabis, you wouldn't get high at all, even if it had thousands of milligrams of THC in there. But if you got that plant and put it in the oven for a little while at 60 or 70 degrees, or you smoked it and added heat, that would then take off that A molecule, the acid, and that will make it active. So we call that decarboxylated. So then the molecule can go into our bodies and bind onto our cannabis receptors, and then we can get that pain relief effect, we can get the high effect or the euphoric effect. All the effects of cannabis medicine are generally more pronounced when we heat those products. So in the medical area where I work, generally all of the medications that we have are decarboxylated, meaning they're activated. Next one, thank you. And that's just saying we need to add fire or heat to our medicine. So generally all the medicines you'll receive from, if you came to see me, would be decarboxylated unless you were getting the dry flower, in which case we would heat it when we used it. Next one, thank you. So there's many, many different types of cannabis in the world, and strain is a controversial word. The correct word we should use is chemovar. So a chemovar of a plant, any plant, is the type of plant. So if we're talking about tomatoes, we would have your Rouge de Marmande, we would have your Tom Thumbs, we would have your Tiger Greens, we would have your purple tomatoes, and we'd have your yellow tomatoes, and we have your cherry tomatoes. They're all chemovars or strains of tomatoes. In the world, because this plant has been so popular for so long, gardeners and growers have been breeding a myriad of chemovars of strains of cannabis. And that's to our advantage in the medical cannabis field, because every different plant has a whole suite of molecules in it. And I'm a bit off my slide topic, so we'll probably come to it later, but I'll talk about it now while I'm talking about it. THC and CBD, they're the main cannabinoids. They're the main active ingredients in the plant. But there's over 144 other different cannabinoids, and probably more by now, that have been discovered in the plant, or potentially in any cannabis plant. There's not only THC and CBD, there's CBV and CBN and CBG, lots of different CBs, but different types of cannabinoids, okay? And they all have effects in our body as well. Not only that, the thing that gives cannabis its smell are things called terpenes. Now these give all flowers their smells, and there's over 400 potential terpenes found in the cannabis plant. So they work with the THC and the CBD in our body. They work in our bodies as active molecules. So you might know terpenes by their common names. Lavender oil. Everyone knows that if they sniff lavender oil or rub it behind their ears or under their nose, you get a calming feeling. And that's because the main terpene in lavender is linalool. And that has a calming, anxiety relieving effect on our bodies. And in fact, linalool is often found in cannabis plants, in the medicines that are calming in nature. And then we have a whole suite of these different terpenes. There's over 400 found in the cannabis plant, and they work together with the THC and the CBD and the other 142 other cannabinoids in the plant. And that's called the entourage effect. So what that means is, it's not just the CBD, it's not just the THC, but the whole suite of the molecules in the plant that we need to consider. And they work together. So when we use those medicines, maybe your brother would use a medicine and get a great effect on his pain, but you may use that medicine and only get a mediocre effect. And that's because of the difference in your natural cannabis system and the terpenes and different molecules in those cannabis medications. So that entourage effect is so important. And in Nimbin, at the Hemp Embassy, I know they're very, very big fans of what's called whole plant medicine. So whole plant medicine means we don't just take the CBD out of the plant, and we don't just take the THC out of the plant, but we extract all of the molecules that are in that plant and include them in the medicine. And that gives us different medicine. I'll get to that in a second. But we need all of those molecules as the main thing. If we just take out the CBD or just the THC, which we can do in the lab, and extract just those molecules, studies have been done showing that isolated THC and CBD are not as effective in people's clinical symptoms as these whole plant medicines or full spectrum medicines. So we always want to choose those full spectrum medicines where possible. There is a place for isolated cannabinoid medicines. In fact, have jobs where they definitely can't use any THC because they won't have that job anymore. That will be one of the instances where I would use that isolated medicine. But generally, we always want whole plant medicines, and I know that at the Hemp Embassy they only have medicines, and it might be whole plant medicines except for a few small exceptions. And there's two main types, or chemovars. That brings me back to the chemovars again. There's two main types of cannabis. So there's thousands of strains or chemovars, but there's two main types that we need to consider when we're using them as medicine: sativa and indica. So if we skip to the next slide, please, Esther. The majority of medications that we use as medicine are often indicas. Indicas are types of plants that are shorter, have fatter flowers, have shorter leaves. So that's how we tell morphologically or what the plant looks like. But they have different effects in our body generally. So indica-based medications will be sleepy. They'll be more muscle relaxant. They're usually more of a bodily feeling, so very good for pain. They're an appetite stimulator. So they're softening medications, you could say. The other main type of medication is sativa-based medications. So sativas, although they're still cannabis plants, have different effects. Sativa-based plants are taller, usually grow outside, have skinnier leaves. But the main difference is sativa-based plants will energize you, will keep you awake. They're more of a feeling in your head rather than the body. You may have more creativity, so it may be something where you would be able to, say, use it if you're being active for gardening, or if you're an artist for creating. But you wouldn't want to take those as a medication at night time because they'll keep you awake all night. And that has happened to people in my practice for sure, where they've accidentally got those two types of medication mixed up. and they've used a sativa-based medication, and they say, "Doctor, I can't sleep. I haven't been able to sleep for a week." Well, oh, that's very strange because you were sleeping great last week. And it was simply because this particular person had got those two little tubs mixed up and had used the sativa-based medication at night time instead of the indica-based. Next slide, thanks. So it's something to be aware of, and another reason why, if you are inexperienced, where you should get some guidance in your treatment. Next slide, thank you. Next one, thank you. That's the entourage effect, which we were talking about before, and that's just saying that all those molecules in the plant are very important. Next slide, thank you. And this is the slide that I was talking about before, once again, talking about all the different elements of active ingredients that are in the cannabis plant. Next slide, thanks. And this is a slide indicating just a few of the minor cannabinoids that are very relevant. And there's an interesting one there, THCV, or tetrahydrocannabivarin. And it's an interesting minor cannabinoid which I've been looking at recently because I've had a few patients with diabetes. And that molecule has actually been shown to help reduce blood sugars. So if you've got a cannabis medicine which has that type of minor cannabinoid in it, it may help reduce your blood sugars and relieve you a bit of your insulin or your other oral anti-glycemic medications. Yes. Yes. You can knowingly prescribe that if you have the knowledge of the strain breakdown. So when we get medications presented to us as doctors, I always ask the producer for a breakdown of the cannabinoids and the terpenes. Some people have that available, some don't. And in some strains of medication, you can see that it is there. And so I would make that choice clinically. And that would depend on so many things, but availability, and yes, in a way you can. Next slide, thanks. And this is just an image indicating those terpenes that I was talking about. One of my favourite terpenes is the one in the middle. It's called beta-caryophyllene, and it's also found in black pepper, and it's an amazing terpene because it actually comes into our body, and it's a great anti-inflammatory. It goes into our body and it binds to the cannabis 2 receptors, which are all the types of cannabis receptors which are found on our immune cells and our inflammatory cells. So that particular terpene is found in a lot of the pain-relieving strains of medications, some of your heavier indicas, such as your Kush strains and that sort of thing. But it binds onto those receptors, and it makes those receptors, those cannabis receptors, stronger at holding on to THC and stronger at holding on to your natural cannabinoids, and will down-regulate inflammation in our body. So I always use that as a little add-on terpene which I can give to patients as an oral drop once a day or massage into the skin, and that will help pain relief. It helps bring about pain relief. It's on its own. And my little daughter's here today, and when she was having her teeth come through, I used to rub that terpene on her, and 10 minutes later the crying would stop. So that proved to me that that really did work, especially when I got some sleep. So next slide, thank you. So this comes, now I'm just going to briefly talk about the endocannabinoid system. I'm not going to get into specifics today about how we treat this medication, how this problem or that problem. That'll come up when we do question and answer time. So I want to talk to you about this endocannabinoid system now. So next slide, thanks. So cannabis has been a medicine which our bodies have utilised since the dawn of time. In 1964, the cannabis molecule was actually isolated by a professor, Dr. Mahulem. But this medicine has been present in our bodies forever. Next slide, thanks. And as we've evolved with cannabis, it's evolved with us as well. So in our bodies, we have a natural cannabis system. It's called the endocannabinoid system. And all that means is inside cannabis system. And we produce endocannabinoids, inside cannabinoids, the main one being anandamide, and that's a picture of anandamide there next to that man jumping in the air. And that comes from the Sanskrit word meaning bliss. So that's the molecule which THC mimics. So anandamide is essentially, our THC in our body. And that's why THC makes us feel happy. When we are regulating our body, we secrete natural endocannabinoids all day, every day. You're doing it right now. The other main cannabinoid is endocannabinoid is 2-AG or 2-arachidonylglycerol. So next slide thing, please. So we secrete these molecules all the time to regulate our body, and they're made on demand when we need them, and they then go and stick to the cannabis receptor, and those cannabis receptors are variably expressed. It means that they're not always there. They might be on that cell one day, but they might hide away again and be popped out again later on. So it depends on where your body needs assistance in any of its metabolic regulation. We will express cannabis receptors. We will then secrete our own cannabinoids. They will stimulate those receptors and make the change required. So for instance, if you had a sore knee from arthritis, around that knee you'd have lots of white blood cells that are trying to fix up that inflammation and causing inflammation at the same time. And the general that organises that army is your endocannabinoid system. Similarly, if you had insomnia and you had troubles with your sleep-wake cycles, which is to do with your melatonin and other neurotransmitters being released at the right times, we might find that those particular areas of the brain will express cannabis receptors because they're waiting to be stimulated so that they can make your melatonin for you. So once again, the endocannabinoid system's in control. When you are an epileptic patient, cannabis receptors all throughout our central nervous system. Next slide, thanks. And that's one of the main locations they're found. And when we have, next slide, thanks, epilepsy, for instance, normally we'll trigger a neuron in our back of our brain that may go through to make us move our arm. Light, a neuron gets triggered, and that will go along. But sometimes if you're an epileptic, that transmission of electrical impulses won't stop. It'll get bigger and bigger and bigger until it turns into a seizure. Now, in us at all times, our cannabis receptors will be expressed, turned on, will secrete a quick bit of endocannabinoid and turn down that electrical signal. In the epileptic patient, that doesn't happen and you end up with a seizure. So you're looking in the brains of the epileptic patients, you'll see lots of cannabis receptors being expressed in the areas of their epilepsy. In Parkinson's, it's a movement disorder that's based around the center of some of the structures in the center of your brain called the basal ganglia and substantia nigra. And that's where we secrete dopamine. And dopamine is important in not having tremors, in good muscle and voluntary muscle control. So if we radio label cannabis receptors, we see there's excess receptors all around this area of the brain saying that bit wants stimulation, but for some reason it's not getting the stimulation, and that's where cannabis medicines will come in. So this is a quote from, no, I won't worry about that quote. Basically, it's the balance system of our body. It's homeostasis, or a fancy word for balance. It keeps our body in balance. When we're too hot, we'll express cannabis receptors in our sweat glands to turn on our sweat ducts so that we sweat and we cool down, and then they'll be taken away when we turn that off again. Our body is intelligent and responds to needs where it needs to be responded to. Next page, thanks. And cannabinoids are present from birth. They're present from conception. So endocannabinoid system guides the growth of our body. It's one of the most prominent, and it's in the highest levels expressed in breast milk. So there's the endocannabinoids are extremely important in association with the suckle response and mother-child bonding, and father-child bonding for that matter. Next slide, thanks. So they're in all of us from the very beginning. And this is just indicating, yes, literally from the cannabis receptors have been found from the second day of gestation in mouse embryos. So as soon as you're created, this system starts developing itself and guiding its own direction, and then guiding the direction of your body's growth as well. Next page, thanks. Next one, thanks. That's just Professor Mahulem. He's an Israeli professor who discovered the cannabinoid molecule, so people consider him the grandfather of THC. He's still alive. He's about 80-something now, and he's actually joining in and talking at video link at a cannabis conference that's happening this year, United in Compassion, up in the Sunshine Coast. So he's still around, and we owe him a lot for finding this molecule. And he is one of, that discovery has then led on to us discovering the endocannabinoid system about a decade later. Next slide, thanks. And that's just a complicated picture explaining the actual chemistry of how cannabis receptors are stimulated, how endocannabinoids are generated, and how they work at the cellular level. We don't need to know about that today, but we do know how it works. This is a real and amazing medicine, and we do know how it works. Next page, thanks. Page, thanks. So this is just a graphic indicating the two main areas of our cannabis system. Centrally located in the brain and spine, peripherally located, associated mainly with inflammation and immune response. Next slide, thanks. And next slide, thanks. We'll just skip through a second until we get the pictures. One more, thanks, sister. One more, thanks, sister. So this is a radio-labeled image showing cannabis receptors in a person's body. And so you can see mainly in the brain, mainly in the central nervous system, all your major organs, your reproductive organs, and then less dense peripherally, but still present. Very important in all your inflammation and immune response. Next page, thanks. And this is just another slide indicating all those areas in our body where we find cannabis receptors, and it really is just all of our organs and all of our body. So in the brain, we've got associations with sleep and learning, memory, neuroprotection, neural development, pain, appetite regulation. In the lungs, we've got that bronchodilator effect I talked about before, liver healing, bone remodeling, muscle fiber formation and control, cardiovascular dilation and blood pressure control, cardiac function, immune function in the spleen, insulin secretion in the pancreas, the guts, gastric motility, how your intestines actually move, and also a very important inflammatory and immune response component in our reproductive organs, and very prominent in our immune system. So it's an integral system. It's the and I'm just so glad that we finally found a medicine that is safe, that we can stimulate this with effectively. Next slide, thank you. And that's once again just indicating this system is everywhere. Next slide, thanks. Next one, thanks. So this is a picture of our brain, and in the middle there is that little area I was talking about in regards to dopamine and Parkinson's. And throughout all these important areas of our brain, where it's loaded with cannabis receptors. There's more cannabis receptors in the brain than there are receptors for any other neurotransmitter. That includes opioids, that includes acetylcholine, that includes everything, adrenaline, noradrenaline, dopamine. And importantly, there's a lot of receptors found in that central area, and that's our old brain. Oh, reptile brain, people call it. So that's why cannabis is great as an emotional regulator. It's great for anxiety, because that's the part of the brain that's all associated with the fight and flight response, survival, emotion, anger, learning, memory, good memories, bad memories. So that's why THC is so useful in treating all of these different mental and neurological conditions. Why it's good for anxiety, why it's good for depression, why it's good for tremors, why it's good for seizures, why it's good for PTSD and emotional things and imprints. So in PTSD, what happens is you have a thought on the outside of your brain, the curly bit there, the cerebral cortex. That's your conscious mind, and you think about that thing that happened in the war. And then what would normally happen is you'd be like, oh, that was a bad time, and get on with your life. But if you've got PTSD, what happens is you have that thought, you get a little trigger, a little signal that goes down to that middle part of your brain and turns on your emotional and physiological responses to that thought. So then your heart rate increases, you get adrenaline release, you get cortisol release, you essentially get fear. You got to get up and run or fight that enemy. So that's PTSD. And the exact mechanism of how PTSD is assisted by cannabis is not completely worked out yet. but we do know there's a change in that connection between that thought bit and the deep bit. So after effective cannabinoid therapy for PTSD, that patient will have the thought about that time in the war, but they won't have the heart rate, they won't get the panic, they won't get the fear. So then it's not PTSD anymore, it's just a bad memory. Yeah. Next slide, thanks. And that's just another one of the same. Next slide, thanks. So this is why I was mentioning before cannabis is so safe. This is a picture of the brain, and that little bit at the bottom is the brainstem. And that's the bit of our brain, that's the very deep bit of our brain, the very reptile bit of our brain, which all it's concerned with is keeping our heart going and our breathing going. That's all that little bit there called the pons is really about. And although I've been, bigging up cannabis and its cannabis receptors throughout our body, the one place where they're really absent is in that little lump, in that pons. And that's a great thing. It means no matter how much you can't suppress your breathing and your heart rate with it. You can't turn off your heart and your breathing like you can with opiates. And that's a really big problem in our country and the Western world is we've been using these opiates. Yep, they're great for pain, don't get me wrong there, but there's a lot of other negatives about that. And one of the negatives about opiates is if you have too much, you affect that little center there and you turn off your breathing and you just stop breathing. So cannabis medicine is so safe that it can't turn off that area, you can't hurt yourself. And in fact, next slide. And in fact, there's an effect called the opioid sparing effect, which we utilize as in cannabis medicine. So what happens is if you have opiates in your body, so morphine or endone or tramadol or Panadine Fort, you get a certain amount of pain relief. If you have just used cannabis medicines, CBD and THC, you'll get a certain amount of pain relief. But when we put them both in your body together, we get a much greater nociceptive or pain relieving effect in our bodies. And that's called the opioid sparing effect. So on the ground, what that means is we need to reduce opioids very often or remove opioids from a patient's treatment once we get them up to adequate dosing on their cannabinoid medications. So that has amazing health implications in the number of people that don't die from overdoses of opioids in our society. The side effects of opioids can be quite intolerable. Like people say they feel like a zombie. They just have no heed for life anymore. They often give terrible constipation and make people feel nauseous or just generally not feel very well. So if we can reduce or remove those medications from a patient, they're much happier in a much better spot. Next slide, thanks. Next one, thanks. So this is just a slide, and I won't go deeply into it, indicating how CBD works in our body. So although CBD doesn't directly stimulate our body like THC does, it is very important. CBD, in very general terms, supports our endocannabinoid system or our natural cannabis system. It makes it healthier. It increases the strength of the binding efficacy, it's called, but the strength of the fingers and especially the cannabis 2 receptors, just like my favorite terpene, caryophyllene, does. So what that means is that it has increased regulatory effect on the inflammation and immune system. So that's why, one of the main reasons why CBD is a great anti-inflammatory molecule. And it's just as good as Nurofen or ibuprofen or any other pharmaceutical anti-inflammatories we use these days, without the side effects of gastric ulceration and sore tummies. But not only that, CBD affects many other areas of our endocannabinoid system. One other main point I'll let you know about is the way that CBD will slow down the action of an enzyme called FAAH, which is the enzyme responsible for breaking down our natural cannabinoids, our anandamide. So that means that CBD will boost your natural cannabinoid levels as well. That means you're going to need less cannabis medicine from the outside and you're going to feel better. You're going to have relief from some of your symptoms just from CBD alone, and then we add in THC to get an even better effect. Next slide, thanks. So the endocannabinoid system is spread throughout our body. Its main function is balance, and it's the system which we can utilize by adding cannabinoid medicines into our body. And those cannabinoid medicines are simply mimicking our own natural molecules in our bodies. That's why this is a natural medicine. One thing I always say to patients is cannabis medicines are health positive. So even the side effects of cannabis, the side effects of cannabis are fairly minor. Not really any to do with CBD. THC, you can get some small amount of anxiety or paranoia if you have too much THC without any CBD. You can get a slight increased heart rate or decreased heart rate from cannabinoids. You can get a slight decrease in blood pressure, or less commonly increase in blood pressure from cannabinoids. You may feel a little tired. We can use that to clinical effect if you have got sleep problems from cannabinoids. You can have some motor coordination issues, so be a little wobbly on the feet or a little slow in reaction. But minor things. The side effects of cannabis are minor things. Things that will leave as the medicine leaves your body and your liver breaks it down and we excrete it over 6 to 8 hours. And things that your body will tolerate to over time. So they may be slightly annoying, frustrating and initially, but often as we continue to take cannabinoid medicines, we will lose those side effects annoying us and we won't notice them anymore. So the side effects of cannabis don't hurt you, is what I'm saying. So the side effects of the majority of pharmaceutical medications, they can have negative effects physically on our body, like our livers. If we take too much Panadol, we can fail our livers, we can make it fail. Most medications have side effects. Chemotherapy agents have extremely toxic side effects on our bodies. They're health negative side effects. Cannabis is a health positive molecule, a health positive plant. So we can use it without fear that we're hurting our bodies. In fact, we're doing them good. And there's a lot of nuance to cannabis medicine, and that's why I think it is a good idea to come to some people with experience, to come and educate yourself like this, to talk to the people at the Hemp Embassy who are very experienced with helping people with their treatment choices, to come to a doctor like myself or Jamie or any of the other forward-thinking medical practitioners in this country so that you can get a good, effective, safe treatment. So cannabis medicine is safe, cannabis medicine is effective, and it works on our body's natural cannabis system. So I might, if I'm not sure how we're going for time, I won't bother using any more slides. The main points I wanted to let everyone know here are that cannabis is safe. Cannabis is effective for many, many different conditions. And that's been proven in many, many clinical practices such as my own and through the effect on people who have used these medicines. It's part of our natural body and our natural evolution to use these medicines and to evolve with them. And it's not just about, when we use cannabis medicines, an important thing is consistency. So I think there is a difference. This is one of those arguments you could have with people in the cannabis and medical cannabis space, whether cannabis recreationally used and cannabis medically used is the same thing. And there's arguments for both ways of looking at that. You know, recreational use often is self-medication, but recreational use might be just recreational as well. And I feel that the difference in that is a consistency of dosing or cannabinoid application in a consistent way, aiming to support the endocannabinoid system. So you take these medications every day like you would take any other medication. You wouldn't take a medication for your depression only when you're depressed. You would take it. And cannabis medicine is the same. Although we can treat symptomatically, if you are in pain, yes, a vaporizer of high THC cannabinoids will help you with your pain, but we can prevent that pain. We can prevent that pain by pre-dosing with our cannabinoids and therefore supporting our natural cannabis system and supporting our own natural level of production. And an interesting thing which I didn't mention to you is that THC itself is an endocannabinoid system upregulator. What that means is if you take a little bit of THC, it increases the effectiveness of your body's natural cannabis system at using THC. So it's a self-fulfilling prophecy. It's helping you out. CBD is naturally supporting that endocannabinoid system all the time. So, and I know Dr. Jamie is going to talk to you a little bit about this, and he and I are very similar in thought that we have to support this endocannabinoid system to make it as healthy as possible, and that's the basis of your health. That's the basis of your healing. So if I've got time, I can take a couple of questions. So yeah, an excellent medicine, and I'm happy to take some questions now, and this will bring out a few more things that people want to know about.
Yes.
Thank you.
That was great. Thank you so much. So do we have a supply of all plant prescription medicine in Australia yet?
Yes, we definitely do. The question was, do we have supplyable prescription cannabis in Australia yet? And the answer is 100% yes. Since late 2016, doctors have been able to prescribe cannabis. And at that point, there was, limit in how much was available in the country and supply issues. But now there's multiple companies. There's at least 4 or 5 active growers in Australia now that some of them are just coming to market. Some have been in market for 6 months. There's a lot of suppliers importing still from Canada and other legal areas where cannabis is medically legalised or fully legalised. So there's a lot of medicine in the country at the moment. And in fact, I think at the moment, with the natural growth cycle of cannabis, there's a bit of a lack of illicit cannabis around at the moment. And I've seen a lot of self-medicating patients coming over to the clinics as price point drops and availability on illicit market is reduced. So there's a very good supply at the moment of high-quality cannabis medications in Australia, yes.
Right. Next question.
Yeah, great presentation, Dr. Teh. Really appreciated it.
No problem.
Yeah, a lot of questions there came up from you as you're talking, and I'm trying to remember a couple of them. The first one would be, for people who have had, say, like splenectomies or tonsillectomies, to what extent is the endocannabinoid system compromised?
So, your endocannabinoid system itself will be compromised because those are major immune areas and there's a lot of cannabis receptors in there and a lot of communication that occurs in those areas. The main thing you're going to get in those sort of things, splenectomies especially, is decreased immunity, decreased immune response. So it won't be a lack of endocannabinoids or the endocannabinoid system, but a lack of a major organ which produces your immune system essentially. So you're going to have a lot of lower immune response, and you're going to get more infections and have less immune response to things, so less defense against the outside world. So that's a very sort of specific thing. It wouldn't be a detriment necessarily of the endocannabinoid system, but a large organ is going to have an effect there.
All right, there's a gentleman here. I don't know if the mic will reach, but let's have a look. I'm wearing a mask. I'm staying safe.
G'day, John. Good to see you.
G'day. Good to see you, Mark.
Yeah, likewise. Mate, I've got a couple of questions. One, thanks. Look, I've got a bit of PTSD, and I've been using kind of CBD and THC, probably like a lot of people, kind of bumbling. Sorry, like kind of bouncing around and trying to find that balance of the kind of 2 major compounds that we understand in cannabis, THC and CBD. But what really interests me is kind of how far are we down the line as far as scientific research is concerned, isolating the different terpenes, flavonoids and other compounds that you pointed out as far as a holistic kind of approach, but individually how those affect you as far as creativity and whatnot. So if I want to come to source sativa, which I know is something that I need it. It's something that is very useful to me, but it's really difficult to find. So how far are we down the track to isolating those compounds, and where do you source them?
That's a good question. you can source terpenes. Terpenes can be extracted and isolated, and they are, and they're used in the food industry and medical industry. You can buy 100% terpene oils. You can use essential oils which are high in particular terpenes as well to boost those particular terpenes that you're looking for. So, lavender essential oil, full of linalool, copaibarol, the thing we use in the clinic with my favourite terpene, is 48% pure beta-caryophyllene. So you can essentially order terpenes. You can actually get a lot of the oils which will contain them over in the apothecary, probably here in Nimbin. In terms of isolating and whether that will be a good idea, I don't think that's probably the way to go for PTSD, and I think you would be better off selecting strains and medications which are high naturally in those type of terpenes, and you could also add them as essential oils orally as well, or inhaled. A big thing for PTSD, I think, really is a lot of CBD. So a lot of people will make the mistake of too much THC, and that can be destabilising to a PTSD patient. In PTSD, you've got anxiety, you've got hypervigilance, you've got your night terrors, emotional regulation. So CBD, I find, is really, really important to have a bit more than you probably think you should have of CBD, of a good quality one. And what you say about sativas is a very common comment I get from people with PTSD, yet I actually find clinically that sometimes that's not the best way. There's always a position for sativa use medications, but because they are generally higher in terpenes like pinene and citrus-based ones, they're more energizing and they can have more of an anxiety effect. So I would generally avoid sativas, especially in a cannabis-naive patient who's got PTSD. Of course, everyone responds differently, and it may work really well for you in that sense, but I would minimise sativa-based medications generally. Yep.
The question is more about how far down the line are we, as far as research is concerned, with these other compounds in conjunction with THC and CBD for specific medical, not just PTSD, but other.
Yeah, no, very. We're getting there, definitely. There's a guy called. What the question was, how far down the line are we with isolation of terpenes and their effects medically and clinically, not just on PTSD, but on all sorts of diseases. Yeah, with cannabis. Yeah, so a fair way actually. There's a doctor named Dr. Russo in the States. He was one of the guys, he's one of the leading cannabis doctors currently, still RUSSO, and he done a lot of work on the entourage effect. And what you're talking about there is the entourage effect, essentially. So that whole plant medicine and picking the right strains that contain the terpene profile that you want. So there's been a lot of work done on terpenes and their effect in isolation and effect with cannabinoids. So we use them all the time. And terpenes are the main basis of differentiation between your sativas and your indicas. So indica-based flower will have a lot more myrcene, generally, which is found in mangoes as well, which is that body relaxation part, generally have a lot more beta-caryophyllene. And your sativas will generally, as I said, have a lot more pinene, have a lot more citrus-based terpenes, activation terpenes, yeah.
Next question from this lady.
I was wondering, when you were talking about the spleen, and our natural cannabinoids, the anandamide and the AG2, whatever it was, thing. So does the spleen affect, not having a spleen, does that affect their production? And if not, where are they produced and what do you need to produce them?
Question. So will taking your spleen affect your production of natural cannabinoids, and where are those cannabinoids produced? And the answer to that is cannabinoids are produced on demand where they're needed. So there are ways to boost your cannabinoid production naturally. Diet is a really important one. So having enough omega-3 oils in your body, so fish oils, hemp seed oil, flax seed oil, chia seeds, they're good sources of omega-3. And omega-3 levels generally in our world are lacking. We're very, very low generally in the Western world. So Omega-3 is the good fat everyone tells us about. When we eat it, it goes into our bodies and it's stored in our bodies. And it's not stored just as fat, it's actually stored in the cell membranes of our bodies. All of our cells are made up of fat on the outside and little water-soluble tails in the middle. That's every cell in our body. So when a cell is stimulated to produce endocannabinoids, and that can be any cell in our body, it takes a little bit of the fat out of those membranes and turns them into a cannabinoid, and then it puts it out into the synapse and it connects to the receptor. So having your spleen taken out, it's not going to affect your endocannabinoid production as a whole. It's definitely going to affect your immune response, because it doesn't matter how many cannabinoids you produce, you haven't got a spleen. So you can't fulfill those immune sort of functions. It's a bit of a yes and no answer. So cannabis is produced where and when it's needed, and so are the receptors. So as I was mentioning, that's why it's site-specific. So you might have epilepsy, I might have osteoarthritis. We could take the same medication and both get a great result. And that's because when I take the medicine, it's focusing on where the cannabis receptors are, and that's around my knee. When you take your medicine, it's focusing on where your cannabinoid receptors are, that's around your brain. So other ways to boost your endocannabinoid system are really simple. You know, a clean diet and lack of inflammatory chemicals. Omega-3 oils are very important. Looking at your gut health is very important, so probiotics are very important. And there's many different herbs and foods that will help boost your endocannabinoid system as well. Turmeric, I'm a big fan of turmeric. I've actually got a turmeric drink that we produce called Dr. Teh's Elixir, because turmeric has been shown to increase your natural endocannabinoid production. Black pepper, once again. Echinacea, also. Some more off-centre herbs like ashwagandha. So there's a whole bunch of red clover. There's a whole bunch of compounds which will help you make more of your own endocannabinoids. And that's one of our strong focuses in the clinic, is just to make sure people are aware it's not just taking your cannabis oil, but if you do a few other basic things in terms of diet and supplementation, you can boost that cannabis system as well. No worries.
I think that's the questions for now. There'll be more questions later on.
I think I'm a great believer in if the truth can be told, so it's understood, it'll be believed. I think he does it really well. What do you think? So I just want Dr. Jamie to talk now, and then we'll have some lunch. There's a great lunch out there. And then John will come back later and ask more questions, and we can talk more generally. But also you'll be hanging around. He will be hanging around. You feel free if you want to talk to him. You'll get a quick free consult. Anyway.
Actually, Michael?
Yes.
I've just been asked to pause for a second. Apparently there's a whole lot of questions on the feed.
If people didn't hear me before and you need toilets, you go to the end of that little veranda and walk down a long ramp. A whole lot of questions coming, because I really want to thank Christian and Maria, who are on the machines here, because they've worked out how to live stream it through his mobile. So it's live streaming on the Hemp Embassy Facebook, and now Sister's got all these questions come in. Very difficult.
Well, if you want to hold them to later.
I don't mind. We do a few. You'll be quick.
Yeah.
Good on you. You going to do questions now?
Just you talk them out, sister. I think I'm not allowed to prescribe in Western Australia. So to prescribe in Western Australia, you have to be in the state. So I'm not 100% familiar with their rules, but I am under the understanding that there is a limit to THC per day that can be prescribed without a supporting letter from another specialist, like a neurologist or something like that. Yep. It is legalised. Dementia is very useful. Cannabis is very useful for dementia, usually low dose. Often the patient can't communicate well, and it's really about quality of life for the patient and the neuroprotective effect. So we'll take some more questions later. We'll let Dr. Jamie come on and we can answer those feed questions later. So thank you very much for listening.
Thanks very much. He's a beauty, isn't he? And that's the Plantmed clinic in Brisbane. And I do know that a lot of people that Dr. John sees are just to get advice. They might be getting cannabis from somewhere or growing their own if they're game, which is great, I reckon. But he has the knowledge to help you work out your dose. Now, this is Jamie Rickord from the Ananda clinic in Byron. Ananda clinic, correct? First time he's talked to the Medican. I'm so appreciative you've come over. Really appreciate it. And he's also going to touch on something else, which I think's got a massive future. We've got to save the planet, don't we? Which is using psychedelic drugs or psilocybin mushrooms or MDMA. He's also started looking at that and working with that, and there's a massive future in that. He'll talk to you about it as well as cannabis. Thanks, Dr. Jamie.
Thanks everybody. Yes, so John covered a lot of what I'm going to talk about, but we'll go over it again. And I have a slightly different perspective on it these days. This talk is called Endocannabinoid Medicine, a gateway to psychedelic-assisted psychotherapy. That is my little poke at the system, who have spent the last 50 years telling us that cannabis is a gateway drug to harder drugs, which is bollocks, isn't it? The truth is that trauma, emotional trauma, and poor mental health is a gateway to harder drugs. And until we start addressing that, we're not going to get anywhere. Can we have the next slide, please? So, where's this going? I'm going to talk about a new way of thinking, which all of this is. And I'm going to talk about the endocannabinoid system's role in mental health and how we can use it to treat mental health, anxiety, PTSD, depression, and how I actually believe that we have more separation now, you know, cannabinoids, psychedelics. The truth is that these are all natural plant-based medicines that nature gave us for our healing, and humans ignored that and banned them. And the simple truth is that one plant and a fungus that can grow in all of our gardens has the capacity to fix 99% of chronic health conditions. And we need to start looking harder at that. And that quote at the top there, when original harmony was lost, laws were created. I don't need to say much more. Can we have the next slide, please? So I think what I've learned, and what we're all learning, is that we need to change the way we think, and we need to do it quickly. These medicines, plant-based medicines, psychedelic medicines, cannabinoid medicines, these are questions that I'll sort of touch on as I move through. What do they teach us about human suffering? Does nature contain all of the answers that we're seeking? And what I think about that, especially with humans, until we can design these and build these, we shouldn't be doubting that nature has all the answers, because humans can't build these. We can't really fix them yet either. So to think that nature doesn't have the answers is a fallacy. This is more of a statement. Trauma is the leading cause of suffering in our society. And our cannabinoids and tryptamines, nature's keys to healing our consciousness and our communities. Now, you've heard about the endocannabinoid system and how the cannabis plant contains potent medicine for that endocannabinoid system. We have a tryptamine system as well. That's a serotonin system. And naturally occurring tryptamines, psilocybin, DMT, are potent medicines on that system. And I think as this moves forward, we'll stop separating them, and we'll actually see them as a bigger whole of the human body, which I'll touch on later. And And as John said, and I say, and we'll continue to say, this is about regulation, homeostasis, balance, and presence. And that's a healthy human. Next slide, please. This is Carl Jung. And I read one of his books recently called The Undiscovered Self, and he gave me a piece of learning that really helps me kind of justify how I approach this. Now, you heard John talk about using a terpene on a child's sore tooth, and how he saw that work and he decided to keep doing it. Now, in the modern medical model, if you haven't got a double-blind randomized controlled trial, you wouldn't say there's enough evidence. And what Carl Jung talked about was knowledge versus understanding. So understanding of a fellow human or understanding of ourselves means that we need to leave theory behind. Understanding the individual requires what he called a lèse-majesté. Now, lèse-majesté is French for a crime against the king, for putting the king down or telling the system that it's wrong. And that's what we're all doing here. This is a communal lèse-majesté, because we are saying that the system is wrong and we need change. Each person's unique. Each person has a different treatment process with cannabinoids, and each individual requires individual care. Each person who comes through my office or any other doctor's office is not a statistic. They're not an alphabet letter. But the current medical model treats those people as a statistic. You tick these boxes, I'll give you an SSRI for depression, which I'll talk about later as well. So I think part of this change is providing individual care and understanding that each person is individual. And so his question was, can we understand the individual and the statistic? There you go. Better? Oh, okay. So it's just a nice way of getting around this kind of very medically pharmaceutical double-blind trial way of approaching people. Next slide, please. Now, this guy's one of my heroes. He's called Claudio Naranjo. He's a Chilean psychiatrist and psychotherapist who was really one of Stanislav Grof's kind of contemporaries, but he came to America, working with plant medicines himself in his practice. And he defines health as being in the present moment. The more present we are, the healthier we are. He described all of what we're here to talk about and learn about as a dangerous wisdom, and a wisdom that the patriarchal mind or the kind of patriarchal society we live in doesn't want us to have. He describes intergenerational trauma as frustrated love, and that we're passing that on generation after generation. And the 7 cures for human suffering: wisdom, stillness, empathic love, devotion, submission, self-awareness, and attention. And he's entirely correct. And these medicines, plant-based medicines, tryptamine-based medicines, this is what they offer us, really. Next slide, please. There's a lot going on this side. So my belief is breaking this cycle of suffering, both within ourselves and within our societies. Now, this first image here, this is called the fear cascade. And this is what happens to our nervous systems as we respond to threat and dangerous situations. So down at 0, this would be, some zebras on the plains eating grass. Everything's fine, they're relaxed. And the wind passes through the grass, and there's a rustle, and they all look up and they look around, thinking there's a lion or someone with a gun, and they realise there isn't, so they settle back down and they start eating the grass again. An hour or so later, the same thing happens, and they look up and there's some lions up on the crest of the hill, and they get to stage 1 and they stop there. So they're relaxed, but they're not totally relaxed because there's some lions. Now, we can stay at stage 1. Humans can stay at stage 1. And you can spend an entire lifetime at stage 1, slightly aroused, but but not too aroused, you know, but still there's some trauma. As the lions come and chase them, they move further and up the kind of fear cascade, adrenaline kicks in, they start running to get away, they're trying to save themselves. Then there comes an overwhelm point. Now this is when one of those zebras has been caught. And at that point, there's an enormous release of endorphins. You know, we have endocannabinoids, we have endo-opiates, endorphins. And at that point, our system's flooded with opiate-like chemicals, which help us dissociate from the fact we're about to be eaten. Now, in modern medicine, we treat most pain and you know, many physical pain problems with opiates. But opiates are a response to trauma. So we're taking traumatized people and giving them more of the drug that keeps them in a traumatized state. When you come back down to zero, on the other side, this is where anandamide lives. So when we're present, connected, homeostatic, anandamide is flushing our system. So the cannabinoids bring us back to zero, and the opiates keep us pushed over in this kind of overwhelm. And if we start thinking about addiction, you know, children who grow up in really traumatic environments, who spend their entire lives dissociated from their reality because it's too hard to be in, they leave home and they have to maintain that traumatic dissociation from reality because they don't know how to live in reality. And they have to come all the way back down this fear cascade. So they become addicts. So, you know, back to where I started about these gateway drugs, it's trauma that is resulting in people becoming addicts. It's got nothing to do with cannabis. The image on the left of the back pain, I don't know how many of you in the room have had back pain, but it's awful. And I don't know if you've noticed that when we're in pain, we stay stuck, we hobble around, you know, we can't do anything. And then to treat it, they give us opiates, which keep us stuck. And when I give my patients cannabinoids, which I do every day now, it's not just pain relief. The system, they stand up straight. They start walking properly. So they're engaging a kind of healing response that's innate in the human body. And I think that's something that, as this all moves forward, we need to really focus on, which I'll touch on in a minute, is that our bodies have the ability to heal. The endocannabinoid system is our healing system. And in some ways, it's a bit of a shame they called it the endocannabinoid system because of the stigma around this plant. And more as I work with cannabinoids, I try not to think about the plant too much. I try to get my patients not to think about the plant, but more about the effect that some chemicals from that plant, some compounds from that plant has on their body, which is to return regulation and homeostasis. Now, if you think that every single creature, living creature on planet Earth has any creature with a spinal cord has an endocannabinoid system. It's ubiquitous. The dinosaurs had endocannabinoid systems. They've had a look at the kind of genetics of the endocannabinoid system across species, and they're virtually identical, which means ours is exactly the same as a cat, as a dolphin, as a monkey. They're all the same. There's very little genetic diversity, which means that this system was perfected in the time of the dinosaurs. And out of the primordial soup comes vertebrates with an endocannabinoid system and a plant that's full of medicine for those vertebrate system. So we banned it, obviously. And actually, we banned it very recently. And one of the things I see more and more with people is this idea of an endocannabinoid deficiency. And I think, you know, I grew up near a town in the UK called Hempstead, which is Anglo-Saxon for heavenly hemp fields. So the whole region I grew up in was hemp fields hundreds and hundreds of years ago. Now those fields had farmers, and those farmers, there were generations of hemp farmers who cannabinoids would have been in their life, in their food, in the animals that they ate, in the oils in their clothes. So it makes sense that there's possibly this kind of ancestral and genetic relationship to this plant that when they took it away, lots of people start getting sick. And I think that's what's happening today. And the bottom picture here, which I'll talk about again in a little bit, is an image of someone's brain after they've had a dose of psilocybin. This is a functional MRI scan. Now the one on the left with fewer obvious lines is a placebo. So they didn't have any psilocybin. And the one on the right is somebody's brain after they've been given a dose. And you can see all those new networks that have opened up, allowing people to break out of rigid thought patterns that are keeping them stuck. So they can introduce change into their lives. So this slide is really pointing out that we get stuck in these modes of suffering. We can't get out of it. And these naturally occurring compounds in many plants are actually the tools that will break us out of those cycles of suffering. Next slide, please. And we'll go to the next one. So here's the female version of John's. Anandamide being the most, really the most important part of all of this. And I've really started to believe this, that the plant is a wonderful plant and it does all these wonderful things. It's medicine, biofuel, construction material, clothing, food. But its key action in the human body is to boost the levels of anandamide. Next slide, please. I'm not going to go through all of this. I'll go through a little bit. We'll revise it. We have CB1 and CB2 receptors that occur throughout our body. CB1, central nervous system, the green ones. CB2, mostly in the periphery in our immune system. When they discovered it, this is a fascinating fact, the American government paid Professor Meshulam and his team to find evidence that THC was absolutely deadly, and they wanted evidence that they could wipe the plant off the face of the planet. They sent them off to do the research, and they came back a couple of years later and said, yeah, we've discovered this thing called the endocannabinoid system. Sorry. Therefore proving that it didn't need to be eradicated. And as John's discussed, that system is ubiquitous. It's throughout our body. It's everywhere. It's the master conductor of the orchestra, the master conductor of the orchestra. And you can just read there that it's involved in everything. And we've had a very myopic view in medicine for the last 50 or 100 years about how we treat things. And actually, if we take a step back and look at this kind of global system, and we can use cannabinoids and tryptamines for that, we'll start to get somewhere. Next slide, please. So this is a concept of a thermostat. You all know what a thermostat is. John touched on it as well. We turn the heat up when it's cold, and we turn the heat down when it's too warm. And that's basically how this system works in our body. We have neurons in the brain. There's GABA and glutamate. One's excitatory, one's inhibitory. And as the endocannabinoid system kicks in, if there's too much excitation, it slows it down. And if there's too much inhibition, it allows it to speed up. So finding the balance, really. Next slide. Endocannabinoids, anandamide, 2-AG. What this slide is showing is that they work differently to most neurotransmitters. Most neurotransmitters, the conduction hits the synapse, the transmitters are released, they depolarize at the postsynaptic membrane, and then the signals continued. But endocannabinoids actually work backwards. So when that postsynaptic membrane is depolarized, anandamide and 2-AG are released from there, and then they affect the presynaptic neuron to downgrade its transmission. So if it's excitatory, it's less transmission, and if it's inhibitory, it backs off the inhibition. And it's mind-boggling. The next slide, please. Actually, it's the one afterwards. Can we go to the next one? This one and the next one are how mind-boggling it is. This one in particular. I can't even say half these words, so can we go back a slide, though? Thank you. So this is a great image of how CBD works. And I really like this slide because as complicated as it looks, it actually is quite simple. So we have lots of different receptors that CBD can work on. And its primary job is to boost the levels of anandamide. So it blocks the enzymes that break down that endocannabinoid. So much like SSRIs work, they're selective serotonin reuptake inhibitors. They work to try and increase the amount of serotonin in the synapse rather than having it broken down. And that's the kind of monoamine theory of depression, which is probably not quite right. But that's how they work. And CBD works in exactly the same way as an SSRI. It boosts the amount of anandamide that's in the synapse. It doesn't have so much of a intrinsic effect at CB1 and CB2 receptors. It does have an intrinsic effect at the 5-HT1A receptor. Now that's a serotonin receptor, so that's part of the tryptamine system that I was talking about. And it has a direct effect on anxiety by stimulating that receptor. The TRP, V1, V2 at the bottom, these are basically pain receptors. So CBD alters the transmission of cations and anions across that membrane, and that's especially important for the treatment of pain. It works on adenosine, and then the PPAY gamma receptor is called the orphan receptor. So we don't really know what it does, but CBD has quite a potent effect at that receptor as well. Now all of this is done, it's kind of a lock and a key is the basic science. Can we go back one more slide, please? Thanks. So THC has a direct effect on the CB1 receptor. It's a key, it unlocks it, it has an action. It doesn't work so directly on CB1 and 2 receptors. CBD changes the CB1 receptor, and that actually will affect how THC interacts with it. And a lot of, real-time experiment that some of my patients have told me about when they use flowers, they can vaporize a THC flower, and they overcook it and they get anxious, even though their pain goes away. And then they vaporize a CBD flower, and that takes the anxiety away and kind of decreases the effect of that THC on their anxiety, whilst it still is very effective for pain. So CBD has a potent effect on how THC works. And THC, a nice analogy I use is that you've got a car in the paddock, right? And you've got to get it out of the paddock and you've got to get it going. And in order to do that, you need to jump-start it. Now, the engine in that car, we're going to call that the endocannabinoid system. And the amount of people required to get that car out of the paddock and onto the road and moving with momentum, that depends on that depends on the paddock, how deep it is, how muddy it is, what the road's like. It's individual for each situation. And CBD is the muscle that gets that car momentum. Now THC has intrinsic effects, so THC is dropping the clutch. That's what starts the engine going. And when you get that balance right, that's when the endocannabinoid system kicks in and starts to regulate and starts to treat pain and anxiety and return us into the present moment. Can we skip forward 2 slides, please? Maybe we won't do this one. Next one, please. This is very similar to the slide that John showed you, which really is the kind of emotional brain, So we've got the amygdala, the caudate nucleus, this kind of reptilian brain, and then that's really human consciousness is a result of having a prefrontal cortex. And over a few million years, as we evolved from kind of primates into human beings, our prefrontal cortex is what did that and gave us consciousness. And nature kind of made a mistake with that one because it was giving humans consciousness that started to cause lots of problems, both on the planet but also within us. Because most animals, when they go through traumatic experiences, you'll see them shake. They discharge the traumatic event, whereas humans lost that ability with the development of a prefrontal cortex. So we have this reptilian brain that can really go into override, and that's happening to a lot of people on the planet. So they're operating from that place of trauma, that place of feeling that they're bad, not good enough, unlovable. And the prefrontal cortex is that place of expansion and the interconnectedness of all things and presence. So a lot of these medicines, cannabinoids especially, help tone down that reptilian brain and allow people to feel less triggered. And if any of you have used cannabinoids for the treatment of trauma, you'll know that there's space. They give you space. If you're triggered, there's suddenly some time before the reaction comes. You know, we can spend many years in talk therapy being told to count to 10, but when the red mist comes down, there's no counting to 10. We fire like a reptile. Whereas cannabinoids, they start creating some space in those reactions, as do tryptamines. Yeah, CBD is anxiolytic, so it reduces anxiety, and it does that through anandamide and directly acting on the 5-HT1A receptor. And augmenting the endocannabinoid system is really what can treat PTSD and sort of habitual stress responses. It's not really a cure, though, and that's where a lot of these newer medicines are really fascinating. Can we go to the next slide, please? Before we get to that, I'm going to talk about this. Now, the endocannabinoid system has a major role in balancing the kind of hypothalamic pituitary axis. I'm sure everyone in this room at some point has felt that they have adrenal fatigue, you know, just really overtired and stuffed and burnt out. And constant stress in our lives puts this axis out so that the adrenals just keep going. They just keep producing adrenaline. You know, when that adrenaline goes, we fall in a heap. Now that's because the endocannabinoid system's out and it's not balancing that system. So, you know, increased 2-AG in the limbic system balances or habituates the hypothalamic pituitary axis to stressful stimuli. So chronic stress decreases the endocannabinoid system ability to regulate that axis. And the ECS dysregulation and stress may lead to a hypothalamic pituitary hyperactivity and the development of depression or PTSD. The endocannabinoid system recruits noradrenergic signaling in regulating the stress response. And I talked earlier, I touched on this monoamine theory of depression, that we're depressed because we have low levels of serotonin. And I think for some forms of depression that's not true. I think that when you've spent your whole life in overwhelm and stressed, the natural response is to then fall into depression because it's become too much. The reason how an ECS dysregulation is causing depression, and something I've observed in my practice a lot, is when we start to rebalance, how these symptoms start to slowly go away. And this is a major mechanism for how that's happening. Next slide, please. This sort of touches on the same thing. These are the sort of chemicals, receptors, agonists, enzymes that are really important in the endocannabinoid system. So it has an anxiolytic, anti-anxiety, and anti-depression role. And by treating the endocannabinoid system globally, I think we're far more likely to have successful outcomes for mental health patients. And this is where the augmented psychotherapy comes in, because these medicines help regulate and they help tone down that sort of stressful response and treat our mental health. But they might not treat the core traumas that have put people in that place. And if we go to the next slide, please. This is where I think, you know, psychedelics, especially psilocybin, can be very helpful. There's a very new theory, but emerging theory that actually psilocybin will reset the endocannabinoid system as well. So psilocybin works on a receptor called the 5-HT2A receptor. Now that's the psychedelic receptor. That's in our cortex, and that's agonism of that receptor, psilocybin, DMT. That's what causes the psychedelic experience. Now, when those receptors are firing, there's an increase in serotonin in the brain, And that increase in serotonin in the brain actually will reset anandamide levels. So that last point there, psilocybin flips serotonin's role and drives CB1 to anandamide rather than dopamine. Now dopamine is far more associated with that kind of endorphin opiate response, and anandamide is the bliss and the presence and the regulation. So I think we'll find in the next few years that the psychedelic medicines are actually putting us back down to zero on that fear cascade through upregulating anandamide and the endocannabinoid system. And the other thing that I find most fascinating about all this, there's a molecule of serotonin and there's a molecule of psilocin. Psilocin's the active part of psilocybin. We ingest psilocybin, it gets changed in our livers, and then it goes to the brain to have its action on the 5-HT2A receptor. And that's what that molecule looks like. And they look remarkably similar to me. Now we give people SSRIs and all these other medicines to improve the amount of serotonin in our brain. And it seems quite silly that we banned a mushroom that's full of a compound that is basically nature's version of serotonin. You hear about people microdosing a lot, and as much as it's still illegal, the logic is in front of you. That's why it works. Yeah, and I think in 100 years, my son's 3, and I think by the time he's 20, he's going to say, "So, Papa, did they ban the cannabis plant for 100 years?" And I'll say, "Yes, mate, they did." And they're saying, "Did they ban psychedelic medicine for 750 years?" And I'll say, "Yes, mate, they did." And he'll say, "And you drove around in cars fueled by fossil fuels?" And I'll say, "Yes, mate, we did." And he'll say, "You're fucking barbarians, weren't you?" Next slide, please. So ECS is balance, regulation, and homeostasis. And we can augment that with plant-based medicines that does not just include the cannabis plant, but includes funguses as well. Now, the last section of this talk is a bit more controversial, and it's my little dig at the system that I am part of. Next slide, please. And it's really about how we can use cannabinoids to prepare people for what are essentially curative treatments. So the early research that's been done abroad, and it's beginning in Australia, when MDMA has been used in a course of psychotherapy, there's 80% remission. When psilocybin is used to treat generalized depressive disorders, anxiety disorders, or substance abuse, there's 80% remission. And that's after 3 months with 3 doses of a compound with some nice people in a room. What's interesting, though, is that the drugs we currently use to treat depression, anxiety, block that process. Next slide, please. This is some studies from the States. Now, what that's showing is that people who were using SSRIs before they underwent psychedelic-assisted psychotherapy did not respond as well to the people who didn't use SSRIs. So we're using medicines that don't work, and not only do they not work, they block the only things that do work, which are all illegal. Next slide, please. So 75% of people who didn't use an SSRI and underwent psychedelic-assisted therapy with MDMA went into remission. Those who were using an SSRI, only 36% of them went into remission. Next slide. Now this is the good bit. These are all meta-analysis. This is the gold standard for research, looking at all the research that's been done and drawing conclusions from it. The statisticians say that that has power. So the first guys, they did a meta-analysis of 47 studies. This is to treat depression. There was no clinically significant benefit in treatment of depression using SSRIs. None whatsoever. Severe depression may benefit. 2010, meta-analysis again. SSRIs had no effect in mild to moderate depression, but a small benefit in severe. 2009, nice guidelines. Antidepressants have no benefit over placebo in mild depression. And this next trial, 4,000 participants. SSRI lead to remission in 4% of people. This is long-term use. This takes weeks for them to kick in, daily dosing, lots of side effects. When we use psilocybin, 80% of people go into remission after 3 doses. The last one, 21 antidepressants, 522 trials. SSRIs are more effective than placebo in severe depression. That's it. Now, every day, people tell me there's no evidence for cannabinoids. Every day, hundreds of doctors in this country are prescribing SSRIs for mild depression and anxiety, and they're the ones telling me there's no evidence for what I'm doing. Yet there's lots of evidence to say what they're doing doesn't even work, but they still do it. Next slide, please. Not only do they not work, there's a diagnosis in the DSM, which is serotonin withdrawal syndrome. So we're giving people medicines that don't fix their depression and give them another psychiatric disorder that didn't exist before we gave them SSRIs. And complex PTSD is not even a recognized diagnosis in that book. Next slide, please. Now this is a bit more science about this tryptamine system. We've got that kind of reptilian brain in blue, and this is where SSRIs have their action. And then we've got the 5-HT2A receptor in the cortex, and this is where the tryptamine, so psilocybin, will have its action. There's a lot more of them, which goes back to that slide with the image of the placebo and the post, the psilocybin dose, the functional MRI scanners. A lot more starts to happen in the human brain when these medicines are used. There's more signaling, there's more entropy, so more energy, and the result of that is to decrease rigid thinking, increase sensitivity to the environment, and facilitate an emotional release. And then that results in depression and decreasing and well-being improving. Now, there's a great book, which if you haven't read it, you should read it. It's called How to Change Your Mind by a guy called Michael Pollan. And the best analogy I've ever read for this is his about the use of psilocybin, that if you go skiing, and there's been no snow for weeks and it's really average, you're obliged to go through the ruts of other skiers to get down the mountain. And that's the only way you're going to get down. And then there's a fresh dump of snow, and you can take any route down that mountain you like. And it's more fun than any other time. So the psilocybin is that fresh dump of snow that allows people to take different routes around their thoughts, so they can change their thought processes. And that done in a course of psychotherapy is what leads to remission. Next slide, please. This is a complex slide that basically says that standard medications affect these treatments. Next slide, please. And then this is really confirming that all of these major institutions around the world have proved that what we're doing doesn't work and actually stops these plant-based medicines from working properly. Next slide, please. This is the last one, actually. So most of this talk has been around new ways of thinking, using new physiological targets to treat trauma. They're not new, they've been there since we were apes, but we're now realizing that we should be using what nature's already given us to treat humans. And why that's such a leap still is just mind-boggling to me. Can we use cannabinoids to improve these psychedelic therapies as they come in? I don't think there's any doubt. And is ECS regulation a foundation for using these medicines? And actually, ECS regulation is a foundation for human health. And without it, nothing we do is going to return people back to well-being and the present moment. Yeah, thank you. That's all of it.
Oh, lots of hands up. I get to ask the first question because I got the mic. Doctor, sorry, how do we contact you?
Oh, how do you contact me?
Yes. Talking
Clinic,
about
website, Ananda from the bottom. Sorry, Ananda on the bottom there. That's my clinic.
Ananda.com?
It's anandaclinics.com.au.
Anandaclinics.com.au. Okay. And then very last question before I hand over to our esteemed audiences are, when can psilocybin be prescribed?
When?
Yeah.
Well, it can't at the moment because it's illegal.
When?
Yeah. Well, we're working on it. So the TGA, a submission went into the TGA earlier this year, and their interim response was to not reschedule MDMA and psilocybin at the moment. Their reasons for that were that they were, I can't even tell you how frustrating their responses were. But basically they're speaking from stigma still, that, you know, these compounds have been abused and they cause psychosis, and you'll give birth to frogs and you'll grow another head and all this kind of silly stuff. The process has begun, and a lot of us went back and said, well, hold on a minute, hold on, let's just look at this. So there's another plant, it's called Papaverum somniferum, it's the opium poppy, and the street version's heroin, yet there are legally prescribable versions of opiates that are used every day in our society. And when we prescribe them, we don't think about using heroin. We give our children dexamphetamine for ADHD, and we don't think about ice. So why on earth do we have to think about, you know, bad things happening to people when they take too much MDMA at a party to block us using them in a safe and therapeutic environment? And we're still waiting for the response. The reality is it will probably be next year or the year after that they actually reschedule them. But they will reschedule them, and it is going to happen.
Yoo-hoo!
Yeah, wonderful presentation, Doctor. Thanks so much. I'm sure I'm speaking on behalf of everybody here when I say that. Look, just going back a little bit to the beginning of your talk, you talked about the fear cascade. What I'm really interested in, and I'm kind of trying to express this in a way that's as non-offensive as possible. With this COVID business we've just been going through, yes, I know there was a threat, but it seems to me, and I'd like to hear feedback from you on this one, to what extent the fear cascade was really amplified?
Well, so that comes from a chap called Porges, who wrote a book called The Polyvagal Theory. And his theory is that we regulate each other, you know. So in a therapeutic process, if the therapist is regulated, there's an unspoken element to bringing regulation to their client. When we have small babies, we regulate their nervous systems. We settle them down. We teach them what calm is. And when we're in trauma, individually or collectively, we stop that regulation and we start moving through the fear cascade. And I think COVID, you know, the day the world stopped, was a good example of collective fear and dysregulation. And I think, you know, it's just another trauma on top of all the others, isn't it? And the solutions to that are this. And this needs to start happening on a fairly enormous scale to have a sort of paradigm shift in our consciousness. But yeah, we live in a society where trauma is endemic, and it comes at us in everywhere. You know, TV, radio, news, people who work for, you know, first responders. You know, it is everywhere, and that's the problem. And I think part of this movement, cannabinoids, psychedelics, is really that, you know, that paradigm shift back to nature. You know, we're full of receptors that these natural compounds work on. So that is a connection to nature, and we're being denied it on a daily basis by draconian drug laws that were made by, you know, I won't say it, but
psychiatrists.
Oh yeah, let me reiterate, like, awesome talk. I really
Thanks.
enjoyed it. I guess I had a few questions. I guess the first is, other than How to Change Your Mind, do you have any other reading recommendations?
Lots.
Yeah, maybe I should talk to you after.
Yeah, a good one is that fella Claudio Naranjo. He wrote a book called The Revolution We Expected, which is about this, really. We need to have a major shift in our society, and we need to get away from this patriarchal system that is just very toxic and telling us all what to do. And we need to sort of trust more in ourselves and each other, which is where I started as well with that quote, when original harmony was lost, laws were created, you know. Laws are for people with trauma, I think, and if we can treat that, you know, maybe we can all get on a bit better.
With you. And I guess the second one is just about the psilocybin studies. Did you know what kind of numbers they use with patients, or like kind of what the population, like what the group was like that they did that study on?
They've done lots of them.
Okay.
People with depression, severe treatment-resistant depression. That was the criteria.
Okay. Was it kind of like Australia or the US, or?
US and the UK, Israel. It's just started in Australia. So St Vincent's in Melbourne is doing a study on psilocybin for end-of-life anxiety. So the government finally said that people who are dying could try psilocybin, which is nice of them. There's another one starting in Melbourne for anxiety. So the government actually, which is great. I keep bashing the system, but they've announced $15 million to do as a fund for research into psychedelics, and that does make the Australian government the first in the world to actually put money up to test this stuff. There are some good people in there.
Dr. Jamie?
Thank you, Doctor, for a mind-manifesting chat. I'd just love to hear your thoughts on ayahuasca, DMT.
Well, it's a tryptamine. So, there's research happening into DMT as well, all over the world. It's a more difficult one because it's very much a sort of ceremonial setting. And whether we like it or not, this is going to happen in a sort of clinical model, you know. And I think some natural compounds, it will be harder for them to fit into that clinical model. But I hope in time, and it might take 20 years, but I hope one day that, you know, if you can grow a vine in your garden, why should you be banned from doing something with it, you know? And that's what all of this is about. These are natural medicines, and I think we have a right to be able to use them, just by nature of being human. But yeah, we're a long way off that.
Yeah, Doctor, just a slightly peripheral question. I used to live in a place in southern Queensland where the mushroom, the psilocybin cubensis, used to grow. Why is it that they needed the dung of the cattle to grow? I was just curious about that.
No idea. I think it's got something to do with the sterilisation in the gut. I think, because the spores need a sterile environment. So I think that's what provides it, and then they can pop up when they come out. But I think one thing that's worth clarifying at this point is that all these studies have been done using synthetic psilocybin, not naturally occurring. And there's the first problem with this whole movement is that there are a number of companies around the world trying to patent their method to produce GMP medical grade psilocybin. So, you know, GMP. So GMP is the standard that medicines have to be in order to be sold in the pharmacy. So to use it clinically, it will have to reach a certain grade, and one of the rules is that there's no mold in the medicine. So that presents an obvious issue. So that's the kind of the other side of this whole movement. It's sort of happening globally rather than here yet. But yeah, it will be synthetic initially when it happens. Yeah.
Please repeat the question.
The issues with synthetic as opposed to naturally occurring psilocybin, that's a rabbit hole. If you speak to, I'm doing a course at the moment in a certificate of psychedelic assisted therapies with a charity called Mind Medicine. And we had a lecture from a guy called David Nichols, who is a pharmacologist in the US. And he's the bloke who synthesized all the MDMA that was used in all of the MAPS studies into PTSD. And he did that in the 80s. So this stuff's been lying around for decades because there's been no way to use it. And he thinks that the psilocin, the active molecule at that receptor, that's it. He doesn't care whether it's natural or synthetic. Flood that receptor, you'll get change. Other people vehemently disagree with him because they think there's a plant spirit. There's something else happening that can't happen with a synthetic molecule, you know. And then there's this other fascinating idea of the entourage effect in a mushroom. So why different mushrooms? Why do they have different effects on us? Why are some stronger, some weaker? You know. So there's this plant spirit, and then there's the entourage effect, the same as in the cannabis plant. There's obviously other compounds in there that are contributing to the effect of psilocybin or psilocin at the receptor. And we'll be arguing about this in 50 years still, I can tell you. It's not going anywhere. Just depends on your stance. Mine is getting people better. And if 80% of people go into remission for depression using synthetic psilocybin, then synthetic psilocybin it will be. You know, the rest is irrelevant because those people are no longer suffering.
Dr. Jamie? Just one quick question. I think we're wrapping up here. I really liked your comments on SSRIs, and am I correct in saying that they're not as effective if used with psilocybin or cannabis? Because I always thought SSRIs were a load of rubbish, quite frankly, and I'm sure the psychiatric profession must dislike you.
Probably. There's some good psychiatrists who are very much on board with all this. So the data from the studies has showed that SSRIs blunt the effect of MDMA or psilocybin. They haven't looked the other way around. But SSRIs will interrupt this process, and people will have to come off them before they enter a course of assisted psychotherapy when it happens.
Cannabis increases your serotonin too, so...
It works both ways, but yeah. The ECS is complex. Most of my patients, I don't have many patients on long-term SSRIs anymore because most people have discovered what that slide showed themselves, and then they can't connect to their partner, they can't make love, they're nauseous, they've got headaches. CBD doesn't block your connection to your partner or give you headaches, so people are making their own minds up. And this is the lèse-majesté. This is the, speaking ill of the king, because the system is broken. And their own evidence shows that too, but still there's no change.
Did he just say the system? Did you say the system's broken? Was that a doctor saying the system's broken? Did you hear that? Anyway, I'm with him. Jamie, thanks. It's the first time I think he's talked in Nimbin. You're going to come to Mardi Gras. And it was a bit of a surprise in that talk for you. But this, I reckon, here's the future. This is what will save the planet on lots of levels. You know, us hippies, we had that old saying, we've discovered a plant that can save the world. The only problem is it's illegal. Well, there's actually a few plants. Anyway, there's a lunch on out there now, lunch or whatever, and Nimbin's open. The hemp embassy's up there if you want to talk to anyone. And I think there's a book you have to book in. It's busy today, but you'd work it out. And as soon as we've had lunch in about an hour or 3/4 of an hour, David Halpern will talk. He recently quit being a magistrate. He will tell you why. But a lot of it is to do with the drug driving rules. He couldn't stand taking people's licences away anymore. I mean, our friend Mr. Hunt, the health minister, says cannabis is legal, but you're not allowed to drive. So which in Australia is a major downfall, as you can get. So really want to thank Dr. Jamie. He will be back later with John Teh and David Halpern. And go and enjoy yourself. Remember, the toilets are down that long ramp. Thank you. Thanks, Jamie. It's great.
That was fun.
See how people